Hi, I'm Dr. Joe Kaushik, andrologist practicing in Caroline John Hospital, Nagarkoil. Today, I will discuss about the surgery which we are about to do. It's a varicocele surgery which is done through microsurgical intervention. This surgery is done for a patient with left-sided grade 3 varicocele and his semen analysis was showing azoospermia. So what we did is we checked his hormonal status which showed features suggestive of his Sertoli and Leydig cell dysfunction. This in turn has led to his azoospermia. So because of his varicocele, his Sertoli and Leydig cell function has started to reduce, and at this point of time it has reached to a level of zero sperm, which we call as azoospermia. So what we are going to do is, first we are going to correct the varicocele through microsurgery, and then we are going to stimulate his Sertoli and Leydig cell function through growth factors, which is a concentrated form of growth factors which will help in improving his Sertoli and Leydig cell function. So usually in this kind of scenario, if the varicocele alone, if it can give 50% improvement, along with this growth factors, it can give up to 75% improvement even in case of azoospermia. So now you can watch the surgical video.
கம்மி சான்ஸ் வந்துச்சு பண்ணிட்டாங்க.